Welcome everyone to this month's BJJ podcast. I am Andrew Duckworth and a warm welcome from your team here at the Bone and Joint Journal. So far this year, our podcasts have either accompanied an original paper or review article which we've published here at the journal. And we've also produced two podcast series on the impact of the COVID-19 pandemic on our specialty, which we do hope you found informative in these unusual and difficult times. As some of you may know, as we did last year, for the months of June and July, we are doing a podcast to accompany our supplements from the American Hip and Knee Society closed meetings. So over the next 15 to 20 minutes or so, we'll be discussing the July supplement of the BJJ that includes 19 papers from the American Hip Society closed meeting in 2019. We hope to give you a brief overview of the Hip Society and who the members are, as well as discuss how our collaboration came about and has developed over the past year, along with how we hope this will benefit you as our listeners and readers. We also aim to give you a behind-the-scenes insight into how the studies within the supplement have been chosen, as well as some brief description on a few select papers. So firstly today, I have the pleasure of being joined by our Editor-in-Chief here at the BJJ, Professor Haddad. Welcome, Prof, and thank you very much for joining us today.
Thanks, Andrew. Great to be here.
Prof and I are delighted to be joined by the guest editor for the Hip Supplement, Dr. Della, who is Professor of Orthopedic Surgery and Chief for the Division of Adult Reconstruction at Rush University Medical Center in the US. Welcome, Dr. Della, and a big thank you for taking the time to join us.
Thanks for having me.
So Craig, if I could start with you, could you give our listeners just a brief overview of the Hip Society and what role it plays?
Yeah, so the Hip Society was created in the late 1960s, and basically to foster interest in North America about hip surgery. You know, right about that same time, you know, John Charnley's total hip replacement was getting very popular. There were surgeons from the US who were going over to watch Sir John do his operation. And when these surgeons got back, they kind of needed a forum to really discuss with each other what was going on, what they were doing in the US. And that's, I think, where things really started for the American Hip Society. And just to give you a sense of scale, in terms of active members, the membership is capped at 100 members. So it's a relatively small society. Mm-hmm. And it's folks who are real interested in the hip joint. Mm-hmm. We have the majority of our members are surgeons who perform total hip arthroplasty and its variants. But I think we all recognize that in a couple hundred years, or maybe sooner than that, hopefully we're not replacing people's joints with metal and plastic. So we have a strong contingent of very skilled and forward-thinking hip arthroscopists and young adult hip specialists who try to convince the rest of us that we shouldn't be using metal and plastic to approach every problem.
That's interesting. And in terms of, you know, obviously that was the original setup of the society. How has that morphed over time, and what are the main aims of it now? How does it sort of get across its message?
You know, I think when we talk about a couple of the papers that in the supplement, we'll get a real good sense of, in my mind, how these societies function by transferring knowledge. But the basic idea is to share ideas. Yeah. You know, I think you see a combination of different presentations at the meeting. And we run two meetings. We run a closed meeting that we call the summer meeting, which is usually in September. Mm-hmm. And then we do a quote unquote open meeting, which is in concert with the American Academy of Orthopedic Surgeons annual meeting at Specialty Day. But the closed meeting is really for members and people who are leaders in the world of the hip in North America to share ideas. Mm-hmm. And I think you see a combination of things. I think I always feel pressure to bring my best things to the Hip Society because, you know, I just feel like it's my peers. These are the people, honestly, who I want to impress, and I want to share with them kind of the cool stuff that we're doing, the great stuff that we're doing. But we also do see a lot, and it's really encouraged in many ways to bring early research, to bring stuff that maybe this is not the final format. And that's why, you know, when you look at how many papers are presented and how many wind up in the supplement, some of these papers that we see at the Hip Society don't get published for a couple of years, but they are earlier ideas that are still kind of gelling. And I think in some ways, those are the most important parts of the meeting, because I, as a member and getting to go to the closed meeting, I get to see stuff that people are working on. Again, that's not final form yet, and where maybe they've looked at the data and they haven't figured out exactly what it all means, and maybe they're presenting it to help figure out what it all means. Yeah. And that's really exciting and really fun.
Yeah, absolutely. So, because I think we got that feel from the supplement last year, but you can very much, when we come on to it, you can see it this year. It's sort of setting almost the trends of where general hip research is going to be as we go forward, isn't it? And also, do you find it also helps refine the data and make it better almost?
Yeah, I mean, I think presenting your work, you get very good feedback because you have a lot of very smart people in the room who really care about hip surgery.
Mm.
So it's really meant to be an open forum, a quote unquote safe place. Now, we know that's not true, right? Because we're dealing with orthopedic surgeons and we're dealing with people who have big personalities and who are really smart and who are not afraid to share their opinions. But nonetheless, I think one of the things that's always fun with the meeting is the discussions.
Yeah.
And we've really tried in the past several years to make the talks shorter, really limit people to 5 minutes, 10 slides. You don't need an introduction slide. We all know what you're talking about, to allow a lot more room for discussion. And, I would say the majority of the discussion was gentlemanly and scholarly, but some of it gets heated. But I think, everybody's, friends at the end of the day, and there's lots of social events along with it. But it's in certain respects nice to see people get excited and get up and say, I don't really think you're telling the truth there, or I don't think you're looking at this the right way, or have you considered? So I think that's a big part of the meeting. And I always walk away with the meeting with ideas for new research, which, I think is one of the things that, you go to these meetings for, is not only to improve patient care, because I always learn things and I'm like, we should be doing that, but also to generate new ideas, because maybe someone presents something and I look at it in a slightly different way. Say, let's try to look at this. So it's a fun meeting. It's definitely one of the highlights of the year. The meeting's usually somewhere nice. And there's usually good food and time to, see people who you haven't seen. I think hopefully we're going to have a meeting this year. I think it'll be that much more special this year, because I think, I think people miss the personal interaction and the scholarly interaction. They love getting into a room and talking about orthopedics, and we've been deprived of that for the past couple of months. And there's been a lot of stuff in the U.S. with residency and fellowship programs, collaborating with other programs and doing Zoom calls and stuff like that, because I think people just really crave that interaction with their colleagues to discuss cool stuff that they're learning or they're seeing or they're not understanding or something.
Absolutely, Craig. No, I totally agree. And that's a really good overview and insight into what the hip study is for our listeners. So, Prof, if I come to you next, could you give us some insights into how the collaboration between the journal and the Hip Society has sort of come about and developed over the past year, for those who don't know?
Thanks, Andrew. So this is a 3-year process that we have agreed to together. So we're now, this supplement will be the 2nd year output. And the supplement last year really was extremely well received. There were some excellent papers. And as Craig had said, it's a synthesis of some of the new work of the thought leaders in hip surgery in North America. And I think that's extremely valuable, to take those thoughts, take those ideas, take those discussions, synthesize them into papers that stand up to what is a very robust peer review process at BJJ, and bring it together to something that can be disseminated internationally. So we have from all over the globe received feedback on how welcome it was to see such richness of high quality work disseminated together, and also to see some of those ideas, some of which are not necessarily those ideas that are driving hip surgery outside the United States quite so feverishly at that time, but will inevitably spread outwards. And so people are getting an insight into things that are going to affect them in one way or another in future, or at least an understanding of where the biggest volume of work is going on and quite how they're working. So I think it's been a very positive thing for the BJJ. I've had the privilege of attending those meetings that Craig has described. They are truly wonderful. And added to that, we've of course got the prize papers, which are really very hard fought, international submissions from all over the world, a very competitive process, and I think some very impressive outputs sometimes. For the journal and for our readership, it's wonderful to see all this in print in this medium, and I hope that for the Hip Society, it is of benefit to have this material disseminated beyond the United States in a very clear, very crisp way.
Absolutely. Yeah, no, absolutely, Prof. And I think the benefits are without doubt there to the reach of the journal, and like I say, we hope to the Hip Society. And if we, as you mentioned, the prize papers which we're about to come on to, but before we do that, Prof, if you, just for the papers in the supplement, just for our listeners who don't know, can you just give them an oversight about how the papers are chosen and the sort of peer review process they go through prior to acceptance in the journal?
Absolutely. So these are all the papers submitted outside the prize papers are papers that would have been presented at the Hip Society autumn meeting, what Craig called the summer meeting. And so out of those authors who feel their work is complete enough for publication submit to the BJJ for a review process. We've been very careful to ensure that review process includes both North American and non-North American reviewers for every paper, so that we get an international review process that's pretty robust. And then once these papers are reviewed, they come back to myself and our guest editor, Craig, who looks at them and advises us as to how we can improve those papers. And then we agree on which papers make it into the supplement and which don't. And there are quite a few that don't make it through, but those that do are usually outstanding and are usually improved by that peer review process.
Yeah.
The prize papers go through a slightly different pathway in that multiple papers from all around the world. People do really cherish these prizes, and some of the best work that there is gets submitted for these awards. So these papers are submitted in fact, they are reviewed by the Hip Society team that Craig leads, with Josh Jacobs, the president for the past year, and they will determine those prizes. That once they've determined the 3 prize papers, they then go through a BJJ peer review process just to make sure that we're looking at the methodology and ensuring that those papers are presented in absolutely the best possible light and as clearly as possible.
Yeah. So it's without doubt, Prof, a rigorous review process to be in the supplement, particularly for those prize papers which we're going to come on to. So, Craig, if I come back to yourself, looking at the supplement, what do you feel have been, before we move on to the prize papers, what do you feel the core or topical themes have been of the papers over the past year?
Yeah, looking at it, it's always such a mix. It's always so interesting, but there were definitely a couple of themes. Dual mobility was definitely one of them, and at the meeting, there were quite a few more papers presented on dual mobility. And in many ways, that makes sense. All the data that comes out consistently shows that dislocation is one of the most common complications that we deal with that complicates a primary replacement as well as a revision replacement. So, it makes sense that we're looking at that. And, the Hip Society, not like any other group, has early adopters and people who are suspicious of any type of new technology. Yeah. And it was, again, very fascinating at the meeting to really see that interplay between the early adopters and the people who were more suspicious of any type of new technology. Yeah. And that interplay was interesting. It was interesting to see how the two different groups in certain ways interpreted each other's data. So
no, absolutely, it's good to have those two extremes almost, though, isn't it? Because I think you get the balanced argument for it. And that sort of moves on to the first prize paper I thought we discussed. That's the one that won the Otto Frank Award, which was from HSS in New York, which, as you say, is was part of a range of dual mobility papers discussed at the meeting, and that was a combined clinical and in vitro study that looked at the mal-seating of the modular dual mobility liners. So could you just give us a brief overview, Craig, of what you think the key messages were from that paper?
The thing I like about this paper is that it's a simple take-home message. Mm-hmm. I think the take-home message for me was you need to be careful when putting in these modular dual mobility liners. There has definitely been concern over, since they came out, about the possibility of corrosion between that metallic shell and that metallic liner that you're inserting. And I think you just need to be real careful when you put that in there. Obviously HSS is, surgeons who are competent and do a large volume of procedures. And to see that just over 5% of them were mal-seeded is striking, and just shows you how careful you have to be. And I think is a lesson to us all that, you really need to expose the socket. You really need to ensure that that modular liner is flush and that it's seated correctly.
I think that's right, and it's like you say, even in a big center like HSS, I think the overall rate was 1 in 20. Even in a high volume center. So I think, like you say, often the best papers they just have a simple take-home message like that, don't they?
Yeah, and as we polled the audience and asked them, there were several surgeons, and this really hasn't clinically been reported to my knowledge, but there were several surgeons who said that they felt they'd seen an adverse local tissue reaction, a patient with clinical symptomatology that required a reoperation because of a mal-seated liner.
That's interesting, isn't it?
Again, I have not seen that. We can ask Faraz if he's seen it published. I have not seen that published yet.
Yeah.
And again, I think that's one of the, one of the reasons why it's fun to be in the Hip Society, because you see this stuff first. You got a bunch of high volume people who do a lot of surgery, and they're going to see stuff first. So
absolutely. Prof, have you got anything to comment about that?
Yeah, no, I was fascinated by this paper. I agree entirely with Craig. A simple message, but tough to know whether the modeling for the corrosion based on the worst case scenario they measured on the X-ray is truly going to be reflected clinically, and how frequent that's going to be. Like Craig, I haven't seen a true clinical correlate, but I've seen 1 or 2 people talking about this and being concerned about it. And ultimately, the increased usage of dual mobility is something that we're seeing rise exponentially. And we're just going to have to be mindful of this problem. And it's amazing how many of these things come back to very basic messages, which is expose what you're trying to do, make sure you see the socket, make sure you put the liner properly, whatever liner it is, because whether we're talking about dual mobility or ceramic or frankly, anything else, if you can't see what you're doing, you're more likely to get it wrong.
Yeah, no, absolutely, Prof. And as you say, it seems to be on the rise. There's obviously another paper in the supplement which we may come on to, but talking about the increase, it was an analysis of the American joint replacement registry showing the trends are definitely going up for use over there. Have you noticed that, Craig?
Oh yeah, I mean the trends are there. Again, I would fall into the early adopter camp in general. And as we started specifically in a revision population to see a high rate of failure of constrained liners, we started to look for alternatives. And we had looked at some data and saw a substantial failure rate of our constrained liners, and most of them were mechanical failures, the locking rings broke or whatever. So we started looking at alternatives and had some good early successes with dual mobility, and honestly haven't seen many negative effects of using them other than the cost of the implant.
So. Sure. So if we move on from the dual mobility, the other 2 prize papers were on the topic of infection, not unsurprisingly, obviously, often something that's talked about at these meetings. And the first was the Frank Stinchfield Award winner as a large international multi-center respective study that used machine learning to study the results of the DARE procedure for periprosthetic joint infection. They had over 1,000 revision hip and knee arthroplasties in that. And the other was the paper from Bostrom and colleagues that won the John Charnley Award. And that reported on the use of a murine model of prosthetic joint infection to study the DARE procedure. So Craig, would you give us a brief overview of those 2 papers and what you feel they've added to the literature?
Well, I think I think with the basic science paper, I think just like we were talking before, I hope we're not replacing hips with metal and plastic 200 years from now. We're definitely missing a bunch of stuff when it comes to treatment of periprosthetic joint infection. And, it's challenging in a short period of time to go over the methods of this complicated and elegant paper, but you should read it because it talks about a lot of stuff that is different ways of approaching the problem of infection and biofilm and dealing with staphylococcal species. And I'm sure that this was a multi-year project that took a lot of time and a lot of care and probably a lot of money to put this all together.
Sure.
So I definitely think it's award worthy just in the complexity of what it was trying to address and trying to give us some new tools in our toolbox to manage periprosthetic joint infection, which not only is common but is associated with significant morbidity, mortality, and costs. So I think any type of treatment modalities that we can come up with that are new and that will potentially work, are certainly award worthy.
Absolutely. And the larger study that looked at sort of the machine learning, obviously we're seeing more of this sort of technique and analysis used in in the literature. What do you think the main take home from that was?
Again, I think a lot of this is in some ways exposure to machine learning, and for people to understand, obviously there's, our brain can process only so much. But the question is can we use things like machine learning and artificial intelligence to do things that we just can't do? And to get us to better answers. And like you said, it's a very large population of patients. It does give you some very useful parameters in terms of which patients are going to be at higher risk for failure. And again, elegant methods, a large sample size, and multi-center, ticks a lot of the boxes for something that can be really useful and important.
No, I agree. Prof, would you anything to add to that for those papers on infection?
No, again, important to see some studies that aren't ready for clinical translation yet, because we need to be in that space. And, like Craig, spent a lot of my career worrying about periprosthetic infection and working on it. So I think it's nice to see some new thinking and some novel modalities. And, the machine learning piece, I think it's very interesting. It's not so much about that data set. It's much more about the fact that that's a concept we're going to have to use more and more. And that's, to my mind, it's likely that because it's a multi-center study looking at a new process that we should all be using and thinking about, whether we're looking at knee alignment, whether we're looking at function, or whether we're looking at infection, machine learning is going to have a role to play in helping us, as is artificial intelligence. So I think that's the future. And that's probably the key takeaway from that paper. So it's, 3 excellent prize papers, and I think we hope our readers will enjoy them. We hope that they will propel people onto new studies and better work.
Absolutely. Well, I think that's a good place for us to stop, Prof, and I think that's all we have time for. But thank you to you both, Craig and Prof, for joining us for our podcast today, and congratulations on an excellent supplement that I think will be a real interest to our readers. So thank you to you both.
Thank you much.
To our listeners, we do hope you've enjoyed joining us, and we encourage you to share any thoughts or comments through Twitter, Facebook alike regarding the supplement, and feel free to post or tweet about anything we've discussed here today. And thanks again for listening.